Hi, thanks for emailing me today in regards of your baby. First of all, you can increase your odds of having a healthy baby by getting early prenatal care. You can also watch what you eat and make sure you have healthy lifestyle choices. Taking special prenatal vitamins will also increase the odds of your baby being healthy. You should also try to exercise regularly and make sure that you get sufficient amounts of sleep each and every day. Most importantly, though, however, be sure not to drink alcohol or smoke in any means, as this will certainly impact the baby in a negative way. Thanks to babycenter.com. Some complications for pregnancies include miscarriages, which is the loss of a pregnancy in the first 20 weeks. A sign of a miscarriage would be spotting or bleeding, and if you experience any of those symptoms, you need to go see a doctor for further evaluations. Premature birth is another complication that women commonly experience. Babies can be healthy if born premature, however, but the earlier they are born, the higher the risk of them living unhealthy. Gestational diabetes is also a complication that occurs in every 2 out of every pregnant woman, but these women can manage it through diet changes and healthy lifestyle choices. Another complication is ectopic pregnancy, is where a fertilized egg implants outside the uterus, and this pregnancy occurs in 1 out of every 50 women and needs to be recognized immediately because it could cause a rupture in the fallopian tubes, which would therefore lead to fatal internal bleeding. Thanks to babycenter.com, I was able to learn that information. Some common causes of atypical development of the fetus include a factor called teratogens. Some teratogens include alcohol and drugs, which will be severely damaging to the fetus, so you need to avoid these at all costs. These are all avoidable if the mother is aware of what she is doing and makes a smart decision. Another cause would be hereditary factors, which can unfortunately not be prevented or addressed. Some of these factors include Down syndrome and autism and are the most prevalent hereditary disorders. Poor nutrition is another reason the fetus will not develop right because it receives all the nutrients from the mother's placenta, so whatever the mother eats, the baby eats as well. This can be avoided if the mother maintains a healthy, balanced diet and makes sure she only puts good things in her body that she would want the baby to be having as well. FloridaHealth.gov is the source that I use for that. During childbirth, the mother of the baby will go into labor, which is where contractions begin to occur in order to help push the baby out ultimately. Labor can last around 12 to 14 hours, but it varies from woman to woman and can go shorter or it can be longer. As for pain, it varies from woman to woman as well, but most experience a decent amount of pain or discomfort. But on the bright side, it is safe for both the mom and the baby to use a form of anesthetic to alleviate any form of pain. Choosing any medication for the pain of childbirth will help the delivery happen a lot smoother and be less stressful on the mom. As for childbirth options, you can either deliver the baby normally through the vaginal opening or through a C-section, which is where the baby is surgically removed through the mother's stomach out of the uterus. I, however, would recommend delivering the baby vaginally if you can, as a C-section is only used in extreme instances, such as when the baby would come out legs first or would not fit through the opening. A C-section will also leave the mother with a large noticeable scar on her stomach and is not recommended. WebMD is the source I use for this question, and that covers it.